Welcome to this week's episode of Talk of the Town. My name is Philip Swiskett, and I am back with my good friend and co-host, Dr. Kenneth Harper from Vein Specialist of the South. If you have questions about your veins, give my friends at Vein Specialist of the South a call, and they will get you the answers that you need. Now, if you're one of our brand new viewers on WMGT, thanks so much for joining us. We really appreciate you inviting us into your homes this week. Here's what you can expect. Every single week, there's going to be a conversation between me, Dr. Harper, and someone in the community that is making a difference. This week is no exception because Delvecchio Finley from Atrium Healthcare Navicent is joining us. He's the president and CEO there, and it's the same hospital that Dr. Harper got his start in the day. Delvecchio, thanks so much for joining us.
Thank you for having me.
Right.
It's such a pleasure to be with both of you.
Right. So Delvecchio, I've been looking forward to this for a long time. And I know we chatted back and forth a little bit about doing it. Thank you for being here.
My pleasure.
When, as a member of the medical community, it was announced probably in late 2020 that you were coming to assume this very important role in our community. People are thinking, well, why did we have to hire somebody from California? But when I studied, I mean, you're really coming home.
That's right.
Right.
That's right.
You're a Georgia guy.
Born and raised.
Tell us a little bit about growing up in Georgia, in Atlanta, and kind of who inspired you to be the man you are today.
Oh, wow. Well, again, thank you so much for having me. And I appreciate this opportunity to engage with you. But you hit the nail on the head. I was born and raised in Georgia, in Atlanta. I'm affectionately and proudly proclaim myself a Grady baby. I was born at Grady Hospital in downtown Atlanta. Raised by a single mom in public housing in Atlanta, and really had all my formative years there, and actually went to undergrad at Emory University. Love bit me there. I met my now wife, then girlfriend, a wife of almost 20 years this year at Emory University, and then that's when life took me to California for almost 20 more years. So you're doing the math and figuring out my age at this point. But it's a great period of time, and it's been so wonderful having this incredible opportunity. I knew about what was then Central Georgia Health System as I was growing up, but I knew it was the Macon Hospital and other names even before that, and then that Navicent Health, but knew about the system and its important role across the Southeast, across Georgia, really. And so this incredible opportunity to come back and be a part of this amazing organization, this amazing team serving this community, just been a really big highlight of my career.
That's great. Now, did you spend some time at Duke University also?
I did.
Right.
You know, you probably lost me a few fans by bringing this up. I went to Emory undergrad, but we like to say Emory football was undefeated because we didn't have a football team. Yes, I went to Duke I had the great privilege of going to Duke for graduate school. I will point out we did win one national championship while I was there. Probably had a little bit to do with me, just a tiny bit. But yes, I studied. I got my master's degree in healthcare policy and administration at Duke University.
At what point in your career did you decide this is kind of what your calling was, to be in healthcare administration?
What a fantastic question. So growing up as a kid, I grew up in public housing, and one of the things that really was impressed upon me was the lack of health. Quite honestly, and inadequate access to healthcare services for people in our community. And, I played the game of life, and it was, you'd be a doctor, you'd be a firefighter, you'd be a teacher, those sorts of things. And I chose medicine. I wanted to practice medicine, which is why I went to Emory. And I worked for a while in a hospital, or two actually, while I was there. And I took a class in chemistry called physical chemistry, and it really kicked my butt. And I thought, maybe science doesn't love me as much as I thought, and I kind of had an existential crisis. But I learned about this thing called healthcare administration, and actually will confess, it was a brief part of it where I thought, no, I want to become a politician, and I really cared about healthcare and making sure that there was adequate access to healthcare services for people. So I wanted healthcare administration or healthcare to be my social policy as a politician, but then I realized that maybe politics is not the right thing for me. And I loved healthcare administration. I wanted to go into a field that I actually knew something about. So I felt incredibly fortunate and blessed that I found this field, and it's been my life's passion, my life's work.
I think when you have a passion for something, you feel a calling for it, it's really not really, it's oftentimes difficult. Sure. But it's not really work. Right?
Yeah.
It's something you love doing.
I had a mentor in college. He said, find something you love and you never work a day in your life. I disagree a little bit with that, but I do love it, and I think you stated it nicely. Yeah. It's a privilege to be able to do something that both does good and feeds your soul at the same time.
So we know a little bit more about you. Thanks for sharing that. And now we're going to talk about Atrium Navicent Health and what y'all are doing in the community, and we'll go back and forth with some good questions, okay?
Fantastic.
Now, Delvecchio, I want to ask you in a minute about what you've done in your first 2 years that you're most proud of. But before I do that, we're going to take a quick commercial break. Stay tuned. We'll be right back.
I'm a mom and a professional outside sales representative, always on the go. I enjoy spending time working in my yard, shopping, and going on long walks. After being pregnant with my second child, I was left with terrible varicose veins in both legs. This caused heaviness, pain, and swelling, which I dealt with for years, but it was more of a cosmetic issue. I wanted great-looking legs. Then a friend told me about Vein Specialist of the South. This office wasn't what I expected. They listened to my concerns, and the staff were extremely caring and informative about the procedure and what to expect. Plus, the procedure had minimal downtime. Since having the procedure, my legs feel amazing, and I have my youthful legs back. I would have addressed it years ago if I'd have known how easy it was. If you want 5-star vein care, I encourage you to call Vein Specialist of the South today.
Delvecchio, you've been here about 2 years now. In that time, what is it you're most proud of that you guys have been able to do at Navicent Atrium?
Well, I have to tell you, coming in what I believe was sort of the middle of the height of COVID was a daunting experience in and of itself. But when I reflect on these 2 years, certainly have to highlight that work as a part of basically the bulk of what we were doing for the better part of a year. Our teammates, our doctors, our nurses, our non-clinical providers really corralling and supporting one another to support the community in what was obviously a once in a generation type of experience. So providing, at that point, fortunately we had vaccines and we were getting vaccines out to the community. We're still doing a lot of testing to support people's ability to quarantine and support themselves and their families if they didn't have vaccines or obviously still needed to go through the course of the COVID experience. So real big highlight that to be a part of a team that really got together, partnered with so many of the community, faith-based communities, schools, the mayor's office, and others to really support all of our community through a very difficult time. Beyond that, I would say two other things. Our ability to support the community in not just providing healthcare services, but advancing health. And for us, that means addressing some of the things that are around access and social determinants. So increasing some of our clinic sites where we've added clinics like up in Forsyth, here in Macon. We have a women's health clinic up there. We've added a new medical oncology clinic here, expanding some of our primary care services out into the community where every single county, I saw an article today, just about every county in Georgia has a shortage of primary care physicians, and we're no exception to that. So we're continuing to invest and grow our primary care footprint, both through our employed group, but also in partnership with community-based doctors. And the last thing I would say is taking care of our teammates. We have really doubled down on our efforts to ensure that our teammates are able to live a sustainable life. Since just before I started, we've done 4 minimum wage increases. We've gone from $12 to $14 an hour, and we hope to be able to do more, obviously where our resources will support it. But in addition to that, we've been able to do merit-based increases and other increases, other forms of support to help our teammates to really be able to take care of the people who we're so privileged to serve in our community.
That's awesome. Tell us a little. I think one of the struggles for every healthcare system has been getting the nurses. I mean, the shortages. How's that's been a big challenge,
Oh my goodness.
What have you seen? Is there light at the end of the tunnel?
Yeah.
How's that looking for us?
It's mixed. I'll say that. I think honestly, you're absolutely right that it has been really, really difficult. I mean, we unfortunately had a lot of people leave the field because of the outsized burden, I think, that COVID really had on us. Impact. A lot of people retired early. Maybe some people took traveling jobs and went to other places or just needed some breaks for being burned out. And so we have really tried to double down in 2 areas, retention and recruitment. On the retention side, really kind of valuing our teammates and helping them as best we can. And I will submit that there's some times when we aren't able to do as much as we'd like to or as much as we want to help our teammates to get through some tough periods where census are high, the impact or the acuity of the patients are really tough. We can't move people because we call it the flow, right? There's discharge constraints in terms of getting people to post-acute facilities or behavioral health services. And so we really try to do a lot to retain our teammates by providing resources to support them. We do a lot of wraparound services for our teammates. We offer what we call care now, so that our help now when people need just immediate, maybe behavioral health. They want to talk to somebody about the stress and the burdens they're feeling. Sometimes they need food services. Sometimes they need temporary rental assistance. All those types of things we offer to our teammates to say, we can help you out. And then we use those same things to recruit as well.
So if their viewers, are there opportunities for the community to have an impact in the hospital setting to encourage, or what do you say there for that?
Absolutely. I will tell you, one, again, during the pandemic, the amount of community support and appreciation that our community showed for our first responders, our teammates, our nurses, our therapists, our paramedics, everybody was just incredible. While it's waned a little bit from the burden of COVID, that need is still great. Our teammates are people too. And so, just working with our teammates when you're in our care settings to help them to help you, right? So you're trying to coordinate and navigate the system. We want to help you. Sometimes there's some things that we're unable to do, and just kind of cooperating and creating a safe environment. We've seen both in the healthcare field and the airline industry where people just pent up stress. They've made for very tense circumstances, and I'd say in those situations everybody's at risk. So I think, if speaking on behalf of our teammates, just know that everybody's heart is in the right place. We like to say assume virtuous intent, and we work with people to do that. So certainly that, but also encouraging people to go into the field and really appreciating the work that's happening in healthcare settings in terms of helping our community.
Right. So you got a friend, encourage them, pray for them.
That's right.
Tell them
we
you care
need
about them.
That's right.
And, if they're interested, pursue a job
That's
in
right.
healthcare.
That's right. Tell them call me.
Right. Okay. Now, February is a big month. It's Valentine's, but it's also a heart health month, right?
That's
so
right.
Red for Valentine, but red for heart health.
Yeah.
Tell us about Atrium Navicent's impact in heart and vascular care in Central Georgia and beyond.
Absolutely.
And what's happening in February that people might want to know about.
Absolutely. I got to tell you, I am incredibly proud of a lot of the services that we provide at Atrium Health Navicent. Our heart and vascular services are some of the most premier services that we offer, and some of the most premier services that are offered throughout the state of Georgia and the Southeast. At our Loose Heart Center, huge investment on the part of many donors in the community, which I'm incredibly appreciative of, and they continue to this day. So one other way that people could help, supporting our foundation and the great work that we do to support the investment in facilities as well as equipment and technology to provide that advanced cardiovascular care that we're so privileged to provide. Over millions of dollars, tens of millions of dollars have gone into creating our heart tower, our advanced cardiovascular ICU, all the services that we provide there. We have the triple crown of our heart and vascular services represented right here in the community. So when people need that care and you're talking to your primary care physician or your cardiologist or your interventional cardiologist, you know that you can come to Atrium Health Navicent and get care that's involved in atrial fibrillation or heart failure or even advanced chest pain. These are all the services that we have very qualified and highly trained physicians, nurses, and other technical staff who stand at the ready to provide those services. And in fact, we are some of the highest volume places in the Southeast that provide those services right here in Macon.
So I know part of Atrium Health Navicent is the Wellness Center that is on Northside Drive. And I've been going to the Wellness Center for a very long time, and I absolutely love it. And I just want to sing your praises for a moment because the people that you have over there are absolutely fantastic. Most gyms are clean, most of them have the same equipment, but it's the staff at the Wellness Center that really puts it on the next level for me and a lot of the other people there. And it is an excellent place to go. So I was wondering from that perspective, I know you guys are invested in health. What is it that you would want to tell someone that's wanting to take that next step for them personally to get in better shape?
Oh, I love that. This is the area that's near and dear to me because I'm actually surprised I haven't seen you there. I am at the Wellness Center several times a week, actually. For a while we have a gym on campus for our teammates, and I was often going there. But for the past 3 or 4 months, I've been going to our Wellness Center, and I can vouch for exactly what you said. The staff there are incredible. They are the most caring, compassionate people. When I took most of December off, they called me out and said, "Hey, we haven't seen you." Don't do that. Let's not do that too loud. But no, it is an amazing place, and so it really is a gem and jewel for the community. Very affordable, and a whole range of equipment and services and classes and a whole host of things that you can do. And we meet people where they are. because we are about advancing health. If you are a walker, if you just want to start with light weights, if you want to swim, all those sorts of things are at your disposal, and we find you wherever you are too. Let's say you are, completely healthy and haven't experienced any illness. We want to keep you healthy. Right. Let's say you're coming from, you got a chronic condition, diabetes, heart failure, maybe you've had a recent surgery for joints or anything like that. You see all kinds at our wellness center, which I love, and everybody is doing their own thing in there. Not only, I would say the staff are amazing, you're absolutely right, but everyone else in the gym. It's a very familial sort of environment.
It is. It's very friendly. It's
Yes.
very clean,
Yes.
and everyone there is just so knowledgeable about what's going on and just about health in general. A couple times I've seen someone that has a question and they go up to a staff member, and the staff member has just a fantastic answer every time. Now, I've also done some stalking of you on LinkedIn. Okay, I looked on LinkedIn. I've seen some pictures of you running in the actual reindeer run. Is that correct?
That's
so,
right.
So do you
That's
do that
right.
as well?
Did my best time in December.
Really?
I won't clock you, but I did get a medal from Santa.
Fantastic. Okay.
For my age range, which is
That's okay. That's okay. Tell us about that race though, and how if someone wants to get involved next year, how they can do that.
So I love that our Beverly Knight Olson Children's Hospital, in partnership with the Navicent Health Foundation, does the annual reindeer run and Santa stroll, right? So it's a 5K run, but it's also a 1 mile walk. So again, meet you at every level. My daughter ditched me this year. Last year she did the run with me last year. This year she exercised her agency and did the stroll, but I think she got lost and ended up walking more than a mile. So. But it's a wonderful event. It's a fundraiser to support our children's hospital and the outstanding care providers and services that we offer there. This year I think we raised about $780,000,
wow.
Which is a really big feat.
At a recent December staff meeting for the hospital's medical staff,
Yes.
you talked about the community forums that you had when you first came to town.
Yes.
Tell us a little bit about that and what you did at those forums, what you learned,
Yeah.
and are there opportunities in the future for that for the community?
Absolutely, yeah. Thanks for bringing that up. We did a bunch of listening sessions. I am a huge proponent of the ratio of your ears to your mouth, right? And not talk so much and listen more. And our community forums are really designed to engage the community and say, what are your needs? What are we doing well with? What aren't we doing well with? Every 3 years, actually, by law, we do what's called community health needs assessment. And my arrival coincided with the completion or the culmination of that effort. The health needs assessment is informed by engaging multiple stakeholders. So again, faith-based communities, some of the patients that we serve in some like housing developments and other sort of things, leaders in those spaces, the business sector, and many others, to say what are the needs from a clinical perspective, but also from a social perspective, and it definitely informs our work. So one of the things that we do is combine that with data, and what we know is our community is heavily impacted by chronic conditions like heart failure and diabetes. Right. Beyond that, we know that from a healthcare perspective, access to care, particularly primary care, as well as behavioral health and social services and things like that are important. Things like food insecurity are also things that impact our community. So, and some of those things build upon one another. So you can imagine if you have a chronic condition and you don't have access to healthy fruits and vegetables, that this is going to contribute to an exacerbation of your health status. So we take all of those things and we come up with a plan for how we're going to try to make progress on those needs over 3 years. So we keep activating that plan. And some of the things I've mentioned that we're doing, we opened a food pantry. And that pantry really serves all of our community. Even some of our teammates are able to access the pantry for their own health needs. But we have a lot of our community that goes there. And we also have a focused expertise for or set of services for people who have heart failure and diabetes. We combine them, their food needs with nutrition counseling, right? We even this past December had a demonstration, food cooking demonstration over in our demonstration kitchen at the Cancer Center, showing people how to make those foods tasty, appetizing, and hopefully encourage them to continue to eat in a way that would actually contribute to their overall health.
Right. Having practiced medicine here in Macon, Middle Georgia for a number of years, the impact of untreated hypertension, diabetes, heart disease, and then renal failure is, and we call it the Bible Belt, but it really is also the diabetes, hypertension, heart disease.
That's right. Too. That's right.
So anything that we as a community can do to address those issues will result in a positive impact on the whole community.
Totally.
Because the amount of resources necessary to treat those chronic diseases is way more than probably the amount of resources that could be to intervene early.
Yeah, yeah. I think that's so well stated. And it has a kind of a residual impact in all other aspects of life. So if it's with kids, it impacts their ability to attend schools or be focused and do well. If you're an adult age, work and being able to stay at work and be gainfully employed and to support your family, all those things impact all of us. And that's why we're really proud that we have a host of community partners that work with us, the Food Bank, Mercer University, Georgia Power even, and other corporate entities saying this is very important and we understand the benefit, collective benefit that it has for all of us.
And Delvecchio, it also breaks the cycle in families, a lot of times when they're struggling with those things. And that's just so important that you guys do that. And I commend you for the work that you've done with that, because you're not only setting up the individual for a better future, but their kids for a better future and their kids for a better future. And I'm convinced there is an actual generational effect that you guys have when you do that. So thank you for coming
Well,
from the
thank
actual
you.
community.
I completely agree, and I appreciate that. We're certainly very much committed to serving the entire family.
Now that you and your wife and your children have been here for almost 2 years, what's the biggest surprise from a positive perspective for you and your family moving to Macon?
Yeah.
And there's I didn't realize this about Middle Georgia and Macon.
Yeah, I have to say, man, there are quite a few. One actually that immediately comes to mind is just the deep and rich history of music in Macon, and that continues to this day. It's just been amazing. I mean, the first time that I met Carla Redding, Otis Redding's daughter, and let me just confess that when I moved to San Francisco from Georgia, my theme song was Dock of the Bay. I used to sing that. I left my home in Georgia at the Delvecchio Bay. So I'm at a dinner event one night and I'm talking to this woman who introduces herself as Carla. And I'm just having a conversation. Next thing I know, Robert McDuffie comes and I'm talking to him and I start talking about this. I share this story and then he looks at Carla and I go, "Why are you looking at her?" And he was, "Oh my gosh, you're Carla." So it's just the coolest thing. I'm like, "Oh my gosh, I'm talking to Otis Redding's daughter." Like, it's just so amazing, right? And then you get, Allman Brothers, you got, just so many other people, right? Jason Aldean, right? It's just such a rich and continued history and present for future music here. And for somebody who loves music, that's just, it's just amazing. Actually. So that's been great for me. Not so much for my daughter because she has to listen to me sing all the time. But what's also been great is it's cool. Like I've been able to be much more engaged as a dad. And so it's more a personal privilege for me. Like spending time with my daughter. We do jam in the car on the way to school and that kind of thing, which I, didn't really have as much time to do before. So I love that. Our families go out for meals and stuff like that. Great restaurants here. It's just been really cool. Really, really cool.
Yeah, and going a long trip around town is about 15 minutes, right?
Well,
as opposed to living in California,
Atlanta or Oakland or San Francisco, 15 minutes, I can still see my house.
All right, so say it's a Friday night. You said y'all are going out to get a meal. Give us some of your favorite spots to get to.
So our absolutely hands down favorite is Oliver's.
Fantastic.
We have kind of our staples. My wife does the risotto. My daughter likes steak and fries, and I generally do the superfood salad. So it's our go-to. I think they know it, but they humor us and let us order. But we do a couple of things. My daughter likes Okmulgee burger, right? We did Find All the Dans and got a free drink. I think I got a free drink, I'm not sure. But we've done a couple of other places. There's a lot of just great places. Loom we like too, the new one. So we've done a couple of spots here. Yeah.
That's great. Now, we were talking whenever we were on commercial, and you said that you're a Duke basketball fan. But Dr. Harper, I do remember a few years ago, what team was it that beat Duke in the finals?
Oh, yeah.
I had to. I'm sorry.
Wait,
I'm sorry.
I think it was Mercer
You know what? I did the commencement address for Mercer School of Medicine in the gym my first year, and I walked in and saw the monument to that game. And I looked over and I said, this is quite offensive. This is a hostile territory. Like President Underwood, you invite me here and you just kind of just put this in my face.
I remember that game. If it had been a night game, we would have gone to it. It was a Friday afternoon game, and we were doing procedures that morning in the office, and we went into the kitchen there and watched the end of the game. And some patients went in there with us, and it was pretty exciting. But Coach K went into the locker room at Duke University after that game, and congratulated them, even though he had to be tremendously heartbroken
Yeah,
losing
yeah,
that game.
yeah.
But it was, they're a class program, and sometimes you lose a game.
Yeah, you do. Well, unfortunately, we're getting a lot of experience with that now. Coach K is now retired, and John Shire is taking over, and there's a lot of rebuilding happening right now. But that's okay. We'll be back. But I got to say this: I'm glad to hear that story. I've heard a lot of those class act type of things that he's done. I think that's just really remarkable. And kudos to the Mercy Bears, and especially because I'm here right now.
Right.
Let's
That's
do
right.
it. Let's do it.
So I understand that there are real initiatives to address maternal mortality and infant mortality related to prematurity. Or can you share some of the numbers about that in Middle Georgia, if you have those numbers to share with the folks?
Yeah,
the
yeah.
impact of that and what we can do to make a difference.
Absolutely. I so appreciate this because this is very a dear subject for me. But in the state of Georgia, or nationally, I should say, the state of Georgia has the second highest rate of maternal mortality.
Wow.
So we are woefully underperforming in this space in terms of being able to take advantage of all the technology and the resources that we have to ensure that more mothers can successfully bring children into life, and that's really an important thing for all of us to be focused on and making sure we do better. And we have a disparity in this space too. African American women are 3 times more likely than the Caucasian population to die in childbirth, and so a huge significant disparity in that community. And quite honestly, a lot of that happens in rural areas. And so when we think about our work here in Macon, serving all of Central and South Georgia, much of which is rural, we have a really, really important calling to be able to support those communities. A lot of high risk OB that happens in those communities, largely from either pre-existing health conditions or inadequate access to care, not even having primary care physicians in many of these counties. We are the regional perinatal center for Central and South Georgia. And so we care for a lot of those mothers who are referred to us from some of the local or regional providers or health systems. We are doing a lot more work to get upstream of that. Coach, we want to address things that actually allow those mothers to carry those babies successfully. A lot of it is stress related. Some of it is just the stress of day-to-day living. Some of it is toxic microaggressions that happen in the healthcare setting because people have biases that people experience, whether it's race related or socioeconomically related, but all those things create a really tough set of conditions for somebody to bring a baby to birth successfully.
One of the sad things in Georgia, every woman that's pregnant can have coverage, at least through Medicaid.
That's right.
I mean, it's not some resources are there.
Sure.
A lot of times there's no one to provide it, or there's not the knowledge that is available.
I think you're absolutely right. There's those 2 dimensions of it. Coverage is not care, right? Coverage is important because it allows you to access the care, but the next thing is actually the care has to be available to you. And so definitely a big part of it too. And so what I'd say, in terms of what people can do, we've been in partnership with institutions like Mercer and Fort Valley, where we've had community forums working with local maternal child experts to tell people about this challenge that we're facing, to create greater awareness, but also then to say what roles we have as kind of part of the broader community, right? The village, if you will, that's able to help when we know that there are mothers of childbearing age, to know that they have access to coverage, know that where they can get those supports, and to come into environments where it's supportive and allows them to bring those babies to term successfully.
Good. Now, Delvecchio, as we move towards wrapping up here, I am curious if there's a young person out there that's been watching this show. This show's been growing leaps and bounds the past couple of months, especially. If there's a young person out there watching this show that's inspired by your story and they want to know, how can I do something as influential as this guy? How can I help as many people as Delvecchio Finley? What do you think you would tell them?
Well, first off, Philip, I want to say thank you to you and Dr. Harper for the work you're doing to create the awareness of all the leaders in our community who are doing some incredible work and making this a great place to live, a great place to work where you can fulfill your dreams. I think, I've been really impressed with Bibb County Schools and the Bibb County School leadership that has been providing kind of career and vocational opportunities. We partner with them in the healthcare space, but they're in a couple of other spaces as well. So whether it's healthcare, whether it is business in general, whether it's some of the social services, individuals can reach out through Bibb County Schools to us or our HR experts. We do a lot of job shadowing experiences or career. We bring a lot of our leaders into settings to talk to people. I just did one yesterday, actually, for the SOAR Academy, where they were graduating and telling people my own story. You know, I was raised by a single mom and had some really tough challenges in life, raised in public housing. But there's a spirit of overcoming obstacles and beating the odds that really lends to, you know, successful life going forward. If you're very passionate about it and committed to doing good in the world, you can do that. Absolutely.
Fantastic.
I always like to ask this question.
Sure.
If there's someone you wanted to thank, who would you like to thank in your life? And it could be one or two people, but who would be the main person you would like to say thank you?
So I so appreciate this question. I could thank a ton of people. I'm going to thank three if I can. So the first is my aunt. I had an aunt when I was growing up who was a tenant association president and really kind of gave voice to the voiceless in our community. And she was my role model. And that was kind of what inspired me to serve, to really want to help people. The second is actually my best friend's mom growing up. She's a school nurse. And I didn't know him when I was growing up. She was a school nurse in my school. We ended up going to high school together. And I would get rides to school from them because I went to school on the other side of town. And she was really a nice inspiration for me, a nice professional who supported me and showed me the way, you know, what was possible. And then finally, there was a family, so I guess it's four, but it was Margaret and William Sims. Mr. Sims has passed away, his wife is still with us, but they did a community program in our community that exposed kids to, you know, just a world outside of the environment that we were in, and really made a huge impact on me, and so I'm incredibly appreciative to all of them, and many others, but those are the three that come to mind.
Thank you.
Thank you.
Yes,
for the
thanks so
opportunity.
much. Our mission of the show is to interview people that are making the Middle Georgia area a better place, and you're the definition of that. So we really appreciate your time for coming on. And thank you guys for tuning in this week and watching us, and stay tuned because you never know where me and Dr. Harper might be next.
As a nurse practitioner, I spend hours standing in the operating room. Plus, I'm a wife and mother of 5. My focus has always been others, not myself, until I started experiencing leg fatigue and horrible leg cramps at night. It was time for me, and as a healthcare professional, I knew exactly where to go. I reached out to the only accredited vein center in Central Georgia that treats veins exclusively. I wanted the best, and that was Vein Specialists of the South. My first concern was whether insurance covers vein care, and I was pleased to find that it does. Meeting with Dr. Harper and the team, they listened to my concerns and developed a treatment plan that was perfect for my busy lifestyle. When my treatment was complete, I was impressed with both the experience and my outcome. Now, at the end of the day, I marvel at my endurance. As a nurse practitioner and a patient, if you need vein care, I encourage you to call Vein Specialists of the South today. You won't regret it.